What happens when a nurse makes a fatal mistake and a patient's life is lost? Today, I want to discuss the trial of RaDonda Vaught, the nurse in Tennessee. RaDonda was employed as a registered nurse, and she floated to the neurointensive care unit in December of 2017. This is an area that she was not familiar with, and therefore she did not take a patient assignment. She was just tasked to help the other nurses with their assignments. The patient in question, a woman named Charlene Murphy, came to this unit with a brain bleed. So she was on the mend, was getting better. This is near Christmas time, so the family was hoping to get her home soon, and she needed a PET scan. And as many people are in the narrow tube of an MRI machine, it can be stressful and claustrophobic. So the primary nurse asked RaDonda to give her the ordered Versed, which is a sedative meant to reduce anxiety and often used during procedures. And this is where the first of many events take place and put the patient at risk. We're going to talk about a lot of things that RaDonda did wrong, and there's some things that she did right, and then we'll discuss the trial. I'm not sure if the outcome is just, but we will see. Her first mistake was overriding the medication dispensing unit. Some have Pyxis, some have Omnicells, different brand, same concept. You can type in the name of the drug and click override and pull it out. She did that and pulled Vecuronium instead of Versed because she just typed VE. Usually these are run under generics, so the generic of Versed is Midazolam and not Vecuronium. For those of you who may not work in medicine, Vecuronium is a paralytic, often used to, in my experience, used to intubate patients because when you give them a paralytic, they no longer breathe on their own, which is necessary when you're trying to put the breathing tube in because you don't want to damage their lungs. But in her case, she was not preparing to be intubated. She was preparing to go into a tube for half an hour with no supervision. By the time that RaDonda had overridden the wrong medication, the patient was already in the radiology department. The radiology department did not have a scanning system where you could scan the med to verify it, and RaDonda chose not to verify it in any way. This was her second mistake that would have prevented this to happen if she were to have followed the proper rules. I know this sounds like I'm placing a lot of blame on her, and I also probably sound biased towards her, or for her, bias in favor of her because I am a nurse, obviously, but this is, I don't know, nursing 101. It's tough for me to look past it, but at the same time, I know this type of thing happens. I can think of instances where the scanner wasn't working and I just had to manually, go through the MAR on the computer and fill it out that way. Where those things differ is that I still had the list in front of me and I could compare the drugs, make sure I had the 5 rights, right patient, right time, right drug, right dose, and right route. So she did not verify the right drug or the right dose, because if she had, then she would have realized that she had the wrong drug and therefore the wrong dose. So RaDonda gave this drug to the patient and did not stay to monitor her outcome or how she responded to the medication, and went back to the unit. When the patient's test was completed, about half an hour later is when she was found to be unresponsive. CPR was initiated. She was intubated and put on a ventilator, taken back to the intensive care unit. After further testing, she was declared brain dead and the family withdrew care. the many mistakes that RaDonda made are easy to make. As far as overriding the Pyxis, when you pull a drug that's just been ordered, you have to wait for pharmacy to verify it, which can be frustrating because just as we are busy, they are also busy, and they may not get to it right away. And if the patient's already in the radiology department, they're waiting for that. They won't start it without it because the patient will get upset. So the added pressure of someone waiting on you and the test not get done right, or maybe you have to just postpone it, maybe she won't be able to be discharged at the right time, can make somebody bypass safety policies in order to get something done. The more common used name, at least in my experience, is Versed and not midazolam. So perhaps she did not realize that vecuronium is not the generic of Versed. Maybe that's what she thought and just wasn't aware. Another thing that is unusual about vecuronium is that it comes in a powder, so therefore it needs to be reconstituted. This is not a common method of delivery for most medications and is never the way that Versed is given. And according to the testimony, that she has given Versed before and it was not powder. And honestly, this should have been a huge red flag. But RaDonda went to trial this year, 2022, and was found guilty of negligent homicide and neglect of a patient. And this is where the true controversy comes, because the state of Tennessee revoked her license in 2021, although this instance happened in 2017. She wasn't charged with anything until 2019. And I discussed this on my channel when it happened. It was concerning then because there's something we call just culture in nursing and in a lot of other medical professions. Mistakes need to be able to be brought forth without risk of repercussions, because if we are at risk for losing our license and going to jail for every little mistake we make, we're going to be pretty unlikely to start reporting those mistakes. Therefore, those safety nets that aren't catching our mistakes will never be found. And that puts us and the patients at even more risk. She may have been more willing to override the Pyxis because the hospital had been having problems with overriding medications and the pharmacy wasn't being able to communicate properly with this machine. Therefore, every pill needed to be overridden. RaDonda's mistake was found because she later gave the vial to the primary nurse so that she could properly scan it into the Pyxis. RaDonda's mistake was found because she later gave the vial of vecuronium to the primary nurse to scan it into the medical record, even though that nurse was not the one who was administering it. I can think of instances in my career where I've had to give meds and scan later because of the situation, because of the urgency, because we're trying to keep that person from coding, or they are already coding, or we need to intubate them, or every time that you give a medication without scanning it puts you, the nurse, and the patient at risk. Unfortunately, this kind of situation has been very forefront in the public eye. I think if she had not been charged with anything, then we would have never known this happened. When RaDonda gave that vial to the primary nurse is when she realized the true gravity of her mistake and what happened. The primary nurse told RaDonda that she gave the wrong medication, and then RaDonda promptly self-reported to the proper management at the hospital. And this is what she did right. Because when you are in a situation where harm has been done, potentially done, or obviously done, the best thing that you can do is to self-report, because that is how just culture keeps working. Just culture makes a culture of honesty and being forthright with the truth. But if a fatal mistake happens and a nurse comes to find that they are the cause, they may think of this case and be afraid to report. Because while we value our patients' lives and we don't want anything bad to happen to them, and we do what we can to keep them safe and get them healthy and get them home, none of us really want to go to jail either. Her sentencing comes just a few weeks after the guilty verdict, and I will be waiting patiently to see the outcome. I'm concerned that a longer sentence will lead to less reporting. The family of the patient, Charlene, stated that Charlene would have forgiven her for this mistake and would not have wanted her life to also be ruined by this very unfortunate mistake. And from all accounts of the family, she sounded like a very wonderful woman. Where do we draw the line on criminal charges? If you do something so fatally wrong that someone dies, do you get to be charged with that? Is that where we draw the line? If someone dies and that's the problem? Or is it the multiple mistakes and unfortunately the blatant disregard she had for the safety measures? Is that where we draw the line? If she had followed just one of the many safety measures that were in place, this would not have happened. And I know it's hard to say for certain, but in my opinion, if she had not overridden the Pyxis, then it would have never even been an issue, but that was her first mistake. If she had taken a computer down to the radiology department and used the scanner, it would have caught it. This was her second mistake. If she had just simply gone through it manually and verified the medication with the MAR and with the patient, this would have been found, and that was her third mistake. If she would have stayed with the patient and monitored their effects afterwards, she may have noticed that she stopped breathing, and that was her fourth mistake. ICU is not an area that RaDonda normally worked. This puts her in an extremely unsafe situation because there's a lot of medications that she's not going to be familiar with, Vecuronium being one of them. I don't think it's fair to throw a nurse into an unfamiliar environment and ask them to help out. This is this workaround with staffing issues. When there's not enough staff to cover all of the patients, then you just throw somebody in for helping hands and they can just help you without having to take an actual assignment. Going from a higher level of care to a lower level of care, this is possible and often happens, and I have done it before. But going from a lower level of care to a higher level of care without proper experience or training is dangerous. My final question with this whole situation is, why was the primary nurse not with the patient at all? In my ICU experience, the patient is never without the nurse. The nurse is never left the patient. They are with them during every test, during every road trip, during every vent change, during everything. The nurse is with them, and they're on a monitor, and they're on a pulse ox. I don't understand why a nurse was not with her if she was in the intensive care unit. Perhaps that was just a policy of Vanderbilt, that it wasn't a priority that the nurse be with the patient. I think Vanderbilt has a lot of fault in this situation as well, and created a situation where she was not going to be safe. At the end of the day, a patient's life was lost unnecessarily, and unfortunately, the nurse is the last line of defense in every medication pass, and she was not a very strong defense against a improper administration. I'm sad for her. I'm sad for the family, because I imagine that just like many of us nurses, we got into nursing to help people, not to hurt them. I imagine that the weight of this has been heavy on her for many years. I'm not sure where she will go from here, if she will serve a short sentence and then be let go. I think if she gets a longer sentence, it's going to be very detrimental to nursing. I realize that's a broad, dramatic statement, but just like many other healthcare professionals, this case has been on the forefront of every nurse's mind. We will check back in on this case in May of 2022 and see where we land. I'm hopeful that the judge has mercy on her. I don't think that she deserves jail time for what happened. I do agree with the state of Tennessee taking away her license. Unfortunately, she did ignore a lot of safety measures, and it ultimately hurt a patient, and for that you cannot be let go of. Thank you all for watching. Please leave your comments down below. I would love to hear, medical or not, I would like to hear your opinion on this situation, on this case. I try to take an opinion from an open-minded state, but also I understand what we go through as nurses working in a busy hospital in an unfamiliar area. So let me know what you think down below, and I'll catch you guys in the next one. Bye.